I would say. Is there a way to do an earlobe reduction without eliminating the lobe part of the ear? A lot of videos I see start with a round lobe, remove some, and sew the remainder flush to the side of the face. Is there a way to keep the lobe the general shape of the lobe while reducing the overall size? Good question. Earlobe reduction is one of those ones. It's a weird one because it's not common. I wouldn't say it's common, but it is a thing. You might think, what are you on about? Because sometimes when someone says earlobe reduction, I'm thinking, what, you've had one of those big earring hole things, or your earrings split the ear or made the earlobe hole bigger. Those are kind of, you can get that when the ear hole's bigger, either through an earring or a spacer, the tribal piercings. But some people just don't like the size of their earlobes. It's nothing to do with the piercings, it's just the size of the earlobes. I mean, I've got quite big earlobes. And it's a weird one because you often think, because they often don't look abnormally large in my view, but the patients are usually really happy. But this is another one where you really need to have a good proper conversation with the surgeon before having it done, because you got to be clear about what you want. Because this person's saying, can I have my earlobe reduced while still having an earlobe that looks quite nice and rounded? Because a lot of photos I've seen has it going straight to the ear. Well, I'll tell you now, a lot of people want it all gone. They want it going straight to the side of the face. They want it gone. And I'm like, I did one not that long ago, and I'll say to the patient, look, this is what I've done here. What do you think? And they're like, still looks a bit big. I'm like, well, I want a sort of like a natural curve of the lobe, so that maybe you don't want the upsweep of the lobe, but you want the lobe to go and curve and meet the side of your head, a normal inverted commas looking shape. But this person's like, because I said, look, if I remove all of, if I make it too pinched, it's going to look a bit pinched, a bit like a pixie sort of pinched. She's like, well, no, I think I quite like that. What, you want to look at, I'm like, once you remove it, you can't give it back. It's going to be really hard to give it back. Oh no, I think I like that. So patient, customer's always right. So, it's about a conversation. So some people want, so you're saying you've seen photos where it looks a bit pinched and it looks a bit like they're taking away too much. Well, the patient might ask for that. So basically, we can do what you want is the answer to that. So if you don't want it too pinched, you just want it a little bit smaller, but you still want it rounded, that's a conversation with the surgeon. And, when you do the surgery, you're basically taking a kind of like a wedge out of the earlobe, and you can adjust how much or how little you take out. It's not a precise science. To be honest with you, none of this stuff is a precise science. None of it. None of this surgery. It's always a little bit like, judgment type of thing. So none of it's precise science. So it's always a bit like, what do you think? That, literally that sort of stuff. So we haven't got any kind of like fancy way of saying, oh, there we go, we do 32 degrees. But yeah, for sure, the answer is it is possible to do an earlobe reduction without removing a lot of the earlobe, basically. So it'll be a limited reduction. So just taking less out of the earlobe. And having said, or maybe I didn't say this, but the earlobe reduction patients, often you think, can I get myself in your head because I think your earlobe looks normal? That's one of the things as a surgeon, you're thinking, should I be doing this? Because I think your earlobe looks normal, to be honest with you. But it's up to the patient really. So sometimes you think, I'm not sure if I should be doing this because it looks pretty normal to me. And you do it, or I've done it, and they're absolutely delighted. Pretty much, everybody has been. Pretty much. I think I have to do one again. But anyway, they're still happy at the end. I have to do it again. I'd rather have to do it again than do too much first time. But and so okay, well that's all right then that they're happy. But it is a difficult one, and it does need a bit of conversation prior to surgery. Because having said that, I do see patients and don't operate on them after these conversations, because I make it clear that it's not a precise science. I try my best. It's going to be a scar. Might be too much. Might be too little. Very hard to put it back if it's too much. If it's too little, you can always go back and do a little bit more. But try and have a proper kind of informed consent with it to try and make sure that it's the right thing to do. But it has been quite good actually, the ones I've done. Although I do say I haven't done huge numbers. It's not like I'm doing earlobe reductions every week. They're not common procedures. So a few times a year, I would say. So it's not like it's common procedure, but it's definitely out there and definitely possible to tailor it to your specifications, your wishes. And if you don't want it looking too pinched, then you can have it that way. And if you've seen some online that are looking a bit pinched, it may be that patient wanted that. That's the thing.